I'm Joxy Joseph, a psychogeriatric nurse in Victoria. I'm going to present my research problem, which is significant to my area of practice and also to all generic and psychogeriatric facilities across Australia. Here is my research problem. The prevalence of resident-to-resident aggression in psychogeriatric facilities and nursing homes is increasing in Australia, and restrictive practices including physical and chemical restraints are still being used to control the behaviors. The benefits of employing 24-hour lifestyle coordinators or diversional therapists in minimizing the potential behaviors and thereby reducing the restrictive interventions need to be identified. Behavioral disturbances from different mental health conditions can usually lead to resident-to-resident aggression. Now, what is resident-to-resident aggression, or RRA? RRA is any inappropriate interaction between the aged care clients that can cause physical or psychological impacts. This can be in the form of verbal, physical, or sexual aggression. The main triggers of RRA includes challenges with communal living, impairments in activities of daily living, impatience and frustration, reduced attention, and also others calling out. Where does RRA occur, and when does it occur? RRA occurs anywhere but mainly in common areas. It can occur at any time of the day or night. Now, what is restrictive intervention? The term restrictive interventions or practices mainly refer to activities which can be either physical or pharmacological that have the effect of restricting a person's free movement or ability to make decisions. There are various negative impacts from the restrictive interventions in controlling the resident-to-resident aggression. This can be either physical or psychological impacts. Why restraints are still in use for managing behaviors? Researchers have identified that the main reason that physical restraint is applied is basically to manage impulsive behaviors, aggression, and symptoms of dementia. A recent literature review of studies of Australian aged care facilities found that the proportion of residents prescribed on antipsychotic medications ranged from 13 to 42% to manage their aggressive behaviors. Data from literature review indicate resident aggression and restrictive interventions are emerging public health concerns in Australia now. It can result in harms ranging from low-scale severity to permanent injury or even to death. According to the first national study in 2017, 28 deaths over 14 years were recognized due to the resident aggression. There are limitations in the availability of data regarding physical restraint use in contemporary Australia. However, some series of studies before the year 2000 identified the concerning physical restraint use in residential care facilities. According to the Royal Commission, almost 2/3 of the residents were taking psychotropic medications mainly to control their aggressive behaviors in nursing homes. Various studies explored the perception of policymakers and stakeholders to advocate for the increasing resident aggressions. And the government has recently introduced the Serious Incident Reporting Scheme to reduce the incidence of aggression in nursing homes. Here, action to eliminate aggression and restraint use is hampered by the paucity of research. Only some limited studies were conducted using both qualitative and quantitative methods. This is where my research problem shows its significance. The majority of resident aggressions were identified as situational reactive, which means they could have been modifiable. Recommendations to prevent restraint use for resident-to-resident aggression can assist in overall improvement in care delivery, respecting the human rights. A person-centered approach is identified as the effective organizational response to resident aggression. It is known from the studies that activities-based alternatives, specialing, and improved staff-resident ratios can also reduce resident-to-resident aggression and also the need for restraint use. Most significantly, the Aged Care Act and Mental Health Act emphasize the importance of a high-quality, person-centered care by ensuring the safety and dignity of residents. So, the concept of hiring a 24-hour lifestyle coordinator or a diversional therapist in geriatric facilities who is well-trained, skilled, and familiar to the elderly clients is a very significant area of study that needs to be explored on a priority basis.